Good morning, ladies and gentlemen. My name is Swatantra Gupta, and I will be the host of our today's event, Last Mile Delivery in Healthcare Services. Ladies and gentlemen, Smile Foundation is a national level development organization which has presence across 25 states. The organization is working in the areas of education, healthcare, skill development, and women empowerment, and support over 1.5 million underprivileged population every year. While on one hand, Smile is extremely active and instrumental in ensuring quality education to those who are deprived of, healthcare to the most needy ones is another primary focus. Smile's healthcare program, especially the mobile medical units and telemedicine centers across India, has gained much importance and relevance in the times of COVID 19. Today, at this platform, we have some distinguished guests who would enlighten us with their thoughts on the importance of primary health care. It's my pleasure to introduce you to our chief guest, Dr. Randeep Guleria, Director AIIMS, Delhi. Guest of honor, Ms. Durga Shakti Nagpal, Indian Administrative Services, Mr. Amitabh Ray, Managing Director, Ericsson India Global Services Private Limited, and Mr. Shantanu Mishra, co-founder and trustee, Smile Foundation. Ladies and gentlemen, with this, I would like to invite Mr. Shantanu Mishra to the welcome address. I would also request him to throw some light on the role of civil society organization in the area of primary healthcare. But before that, I would like to mention that Mr. Mishra has been a pioneer in the field of social responsibility. He has championed a plethora of pressing social causes such as child empowerment, equal opportunity, and social equality. His passion for creating a social change and adding value back to society saw him bringing a group of like minded professionals together to establish Smile Foundation in 2002. An alumnus of IIM Ahmedabad and a company secretary, he quit his highly successful corporate career at its peak in 2005, choosing instead to dedicate his energies to establish Smile Foundation as one of the most successful development organizations in India. Please welcome Mr. Shantanu Mishra.
Good morning, everyone. I would like to begin by extending a warm welcome to our esteemed guest of today, Padma Shri Dr. Randeep Guleria, Director, All India Institute of Medical Science, New Delhi, Ms. Durga Shakti Nagpal, Indian Administrative Service, Government of India, and Mr. Amitabh Ray, Managing Director, Ericsson India Global Services Private Limited. We are living in an unprecedented time, which will probably go down in history as one of the biggest world crises. Probably we reached this level because nobody in the world had ever experienced disruption of such a magnitude, and what started as a health crisis snowballed into a real world crisis impacting every aspect of human life. India is a home to more than 20% of the world's population. In a country like ours with 1.3 billion people, ensuring healthcare for every person is a huge task. Post the economic liberalization, we have certainly made progress in healthcare in different aspects, but there is still a long way to go. In particular, the gaps are acute in the last mile delivery, that is primary healthcare, in which we have different sets of challenges in rural and urban areas. While in villages, there is severe shortage of doctors as well as a lack of awareness and accessibility. In the cities, the primary healthcare infrastructure is under severe stress because of the high density of population vis-a-vis availability of services. These challenges became even more evident during the pandemic as India's public healthcare system focused all its efforts on the fight against COVID-19 and essential primary healthcare services got disrupted. A single health crisis brought the entire world to a halt. I think this is enough to establish that a robust primary healthcare system is the only solution for building a sustainable and healthy society in long run. However, strengthening primary healthcare is not the responsibility of government alone. All stakeholders have a distinct role to play to ensure the effective delivery of primary healthcare services. Specifically, if we talk about civil society organizations like SMILE, they fulfill the crucial need of complementing the efforts of the government at community level by understanding the ground reality, building trust of the community through community mobilization process, creating scalable model projects, documentation and dissemination of the outcomes to all the stakeholders, including the policymakers, liaising with the government, building capacity of the local stakeholders, and establishing linkages of the services to need of the community. As an organization, SMILE is committed to provide primary healthcare services to the most vulnerable communities across the country in remote rural areas and urban slums, complementing government's Ayushman Bharat program through a comprehensive healthcare model consisting of mobile health units, telemedicine centers, health camps, and capacity building of health workers. Currently, every year, our Smile on Wheel mobile health program is providing preventive, curative, and promotive healthcare services at the doorsteps of over 2 million children and families in 14 states, covering over 2,000 villages and urban slums. In addition to this, we have also developed sample collection vans for COVID testing to support local authorities. We understand that telemedicine is a critical technology to take healthcare to the next level at an affordable price, and it's very, very relevant in a country like India. It is with this understanding that we have ventured to set up telemedicine units across the country. We are grateful to Ericsson and other corporates that have lent their valuable support and joined hands with us for ensuring last mile delivery of primary healthcare services to the vulnerable population during this difficult time even. Let me also take this opportunity to acknowledge the efforts of our on-ground health workers who have been working throughout the pandemic to make healthcare accessible for those who need it the most. Thank you very much.
Thank you, Mr. Mishra. Moving forward, ladies and gentlemen, we have Mr. Amitabh Ray, Managing Director, Ericsson India Global Services Private Limited. Mr. Ray is the head of Global Service Centers and Managing Director of Ericsson India Global Services Private Limited. His responsibility is to ensure the continued growth of the global service centers in India, Mexico, Tanzania, and China to deliver the right competency to Ericsson's customers worldwide. He was earlier the head of strategy and portfolio function of Ericsson's Global Services Business Unit. Having managed a diverse group of clients in both private and government sectors in Asia, Europe, and the US, Amitabh's 4-decade-long career has been an exciting journey of building teams, strategizing, leading, and executing the transformation journeys of three Centurion organizations, PwC, IBM, and currently Ericsson. Now, I would like to invite Mr. Ray to share insights about Ericsson's CSR perspective, especially in India, and how it is aligned to primary healthcare. May I invite Mr. Ray?
Thank you, Satnam, and very good morning to all distinguished guests. It's really a privilege to interact with all of you. Talking from Ericsson's perspective, compassion is the cornerstone of Ericsson's corporate social responsibility or CSR. We are driven by a purpose to empower an intelligent, sustainable, and connected world. We believe in using technology for making a positive social impact in whatever we do. It is the DNA of our organization and culture of our people. Fulfilling social responsibility therefore comes naturally to every Ericsson employees as much as it is for the organization. So when this COVID-19 challenge was placed before us, there was no way we wouldn't step forward to do our bit. I don't think or feel that we have done something extraordinary. It is but a natural reaction for all Ericsson employees to step in whatever and whenever such initiative takes place to support human beings, which are beneficial for society, save life, and human. However, we cannot do these things on all of our own, which is why we connect with like-minded organizations like SMILE around the country to support various initiatives complementing government's effort to fight the pandemic. We feel humbled for the opportunity to come to aid of some of the most vulnerable section of people. We are all in this together, and together we must fight back and win. Ericsson will be there proactively in each and every of such initiative. We wanted to take a very holistic approach to rebuilding society during and after the pandemic, enabling job opportunities for youth, strengthening the government's effort towards COVID-19 response and primary healthcare services for the underserved and vulnerable section of the society. Couple of things we have done, just to list here. We made a monetary donation of total 10 crores of rupees between PM National Relief Fund and the State Government Disaster Management Authority funds out of 6 states we operate. COVID-19 mobile medical unit, we created 2, one in Chennai and one in Pune, enabling testing for COVID-19. And between these 2 mobile unit, we so far tested about 10 to 20 lakh of people between these 2 states. Smile on Wheel, another flagship activity taken by Ericsson. These are mobile medical unit, which runs across Noida, Kolkata, Bangalore, and Gurgaon, providing primary healthcare support to the underprivileged in communities. The project provides quality healthcare service at the doorstep of the underserved communities free of cost in order to support the secondary and tertiary healthcare outreach of the government. Over the past 5 years, approx 5 lakhs of people have benefited from this program. So during COVID, we are also continuing with these programs with greater focus. We have 40 Ericsson STEP centers across Noida, Gurgaon, Kolkata, Bangalore, and Chennai, and Pune that are training youth as healthcare professionals, namely general duty assistant and the other allied healthcare workers. We aim to skill more than 5,000 youth in the age group of 18 to 30 and support them in getting employment. We have created telemedicine centers in Chennai and Pune, supporting basic primary healthcare needs across about 12 communities, benefiting over 3 lakh individuals. With the government of Tamil Nadu, in collaboration with them, we have organized a PPE donation initiative some time back for 4,000 sanitation workers across 15 urban local bodies or municipalities in Chennai. Over and above this, we do have our employee volunteering program. Our employees have been volunteering online to support communities using their time and skills from the comfort of their home or desk. 900 plus Ericsson volunteers have participated in initiatives across areas of education, environment, digital literacy, benefiting the communities. I would like to end by saying Ericsson, as a responsible corporate citizen across the world, feels that it must contribute to society. To do this, one needs a framework. So we actively involved with United Nations Sustainable Development Goal or SDGs to enhance financial and social inclusion, contribute to overcome government environmental challenges, both in India and abroad, to improve access to education and health and support any humanitarian efforts. One of the goals are good health and well-being, ensuring healthy lives and promote well-being for all ages. That's what we are talking here today. Thank you very much.
Thank you, Mr. Ray. Actually, it's so encouraging to see corporate like Ericsson and other such multinationals, the way they are helping government or complementing the efforts which government is doing in the primary healthcare space. I think that is what we need. And thank you so much for supporting Smiles Initiative for so many years. With this, I would like to mention that, and it feels great to have to today that we have a representation from government as well. We are privileged to have our guest of honor, Ms. Durga Shakti Nagpal. Ms. Nagpal is a 2010 batch Indian Administrative Service Officer of Uttar Pradesh cadre. It is amazing to know that she obtained All India rank 20 in UPSC as SDM Noida and later Greater Noida in 2012. Durga Shakti earned a lot of public acclaim for her crackdown on illegal sand mining in Jamuna and Hindon riverbanks. She shut down mining cartels operating with apparent impunity in the region and arrested illegal miners and confiscated their trucks and tractors carrying illegal sand. She also served as Joint Magistrate of Kanpur, Chief Development Officer of Mathura, and Officer on Special Duty to Union Agriculture and Farmers Welfare Minister and Deputy CEO, India Brand Equity Foundation. With this, I would like to invite Ms. Nagpal to share her thoughts on how government, corporate, and civil society can together strengthen primary healthcare service in our country. Over to you, ma'am.
Thank you, Swatantra. Very good morning to respected Dr. Guleria, Mr. Mishra, Mr. Ray, and all the esteemed participants today. At the outset, let me put on record my deep appreciation for all the incredible work that Smile and Ericsson India have been doing, especially in this time of distress. And like Mr. Mishra said in the beginning, that promoting healthcare is a collective responsibility and not just that of the government. I feel that organizations like yours are leading by example and paving the path for others to follow and to get inspiration. In fact, it is also noteworthy to mention that the corporate sector has come up in a big way in helping during the pandemic. Talking about PM Cares, the fund was constituted right in the beginning of the time that COVID-19 came. Very soon, in a very short span of time, I think in less than 30 days or so, it had a huge contribution of nearly 10,000 crores. And it's noteworthy to mention that out of those 10,000 crores, a huge chunk of nearly 50%, approximately 4,500 crores, came from the corporate sector. And it may not be a coincidence also that just 2 days ago, the Honorable Prime Minister said in the Parliament that the private sector is going to play a very important role in the development and economy of the country. Coming to the topic today, how we can fulfill this collective responsibility, the government, the NGOs, civil society, and of course the corporate sector in promoting healthcare. I think there are several ways. To start with, we witnessed during the pandemic that there has been huge demand-supply gap in oxygen supply in our hospitals. Now, many of us would know that the World Health Organization has listed oxygen as one of the foremost essential medicines. And whether it is respiratory disease, asthma, pneumonia, neonatal care, or any kind of medical intervention, oxygen is the most basic thing that is required. Now, government is promoting this new concept called oxygen concentrator plants. These plants are very effective. They are cost-friendly, they are safe, and they are easily replenishable. And they've identified some list of 22 companies or so that are putting in place these plants. They can be in the vicinity of hospitals, wherein they can supply the oxygen through pipelines or through the conventional refilling of cylinders. So maybe the corporate sector could think of ways as to how they can take up these plants as a part of their CSR initiatives. Moving on, we're all aware of the problem of migrant laborer that we witnessed. It was so difficult to track their movements, particularly because we didn't have a database that would give us all their details. This is very simple now. For the corporates, for the CSR, it's not even required under their CSR for the corporates to just register all the migrant laborers under this Act of 1979. It's called Interstate Migrant Workmen Act. And it's a very simple form which has to be filled. and has to be submitted to the government. It would provide us all the details, and this detail would help in not only tracking the movement of the migrant laborers, but also in linking them with benefits of government schemes. For instance, the One Nation, One Ration Card scheme, or for that matter, for the vaccination drive itself. Now, speaking about vaccination, as the nation has gone to vaccination, and we are soon going to be vaccinating the first lot of 30 crore of the Indian population, it may be worthwhile for corporates to think of ways as to how they can help the government in funding this expense. And maybe in turn, there could be some kind of tax benefits that could be claimed by them. Ericsson has already done a lot of work in sponsoring mobile clinics for Smile. I think in rural areas particularly, where the healthcare infrastructure is weak, mobile clinics have proved to be very effective and very simple ways of providing healthcare to literally at the doorstep. In fact, examples like Dhanvantri Rath in Gujarat have also been replicated in different parts of the country. And it may be worthwhile for corporates and NGOs to take up these mobile clinics as joint initiatives under their CSR activities. In addition to that, we're all parents of children. We have children in our family. We all know that during this pandemic, how the life of children have completely changed. The schooling system has been impacted. The entire process of studying and teaching has shifted to the digital world. Particularly for humble families, it has been very difficult for children to cope up. By sponsoring simple tablets, they are not expensive at all, and government has come up with this e-Vidya portal, wherein all the syllabus is preloaded to facilitate the teaching process. So by sponsoring tablets and particularly internet connectivity for the children of their own families, it can go a long way in the development of our young minds. There are just a few more thoughts. The corporate and the civil society can also play a very important role in helping the government in promoting preventive healthcare. And this is very, very cost friendly. An example could be distribution of immunity boosters like vitamin C, zinc tablets, Ayurvedic formulations, particularly to the 60 plus population. You would be aware that soon the vaccination would be extended as a part of the 30 crore population. It would be extended to people who are 60 plus and to people who are 50 plus but having comorbidities. Now, for a common man to go to the doctor and to certify himself that he has a comorbidity is a cumbersome task. But for the civil society and for the corporates, it's very easy, perhaps, to organize medical camps and extend this benefit, wherein we would facilitate the process of certification of comorbidities of the 50 plus population. And in one shot, in one single very easily. These are just some of my thoughts. And thank you very much once again for having me here today. And I truly hope that the Lord
I think the connectivity is having some problem.
Thank you, ma'am. I think there were some issues with the internet, but uh, I think overall your thoughts of from the government side, bringing everyone together, especially corporates and civil society, and towards strengthening the health and infrastructure, primary health care, and other aspects of development. I think it's encouraging the way government is thinking and the way corporates and civil society is also taking the step forward. I think that's quite encouraging for all of us. Thank you so much. With this, I know that a lot of us are waiting to hear Dr. Guleria about his experience and thoughts on the subject. But before I invite him, Smile Foundation team would like to share some glimpses of the kind of work they have done in primary healthcare space with the support of Ericsson India Global Services Private Limited. Here, I would like to invite Satnam Singh, who leads the healthcare vertical in Smile, to give an insight of the program.
Thank you, Swatantra. Good morning to all the eminent panelists and to all the participants. It's been a privilege to be here today, and sitting over here when I look back at 2015, when we started the partnership with Ericsson, with the objective of providing the primary healthcare services at the doorstep of the underprivileged. The concept was developed with the idea that let's take the medical services, the availability, affordability, and accessibility of medical services can be ensured at the doorstep of the communities who are underprivileged. From 2015 to 2021, there are various changes in terms of policies, changes in terms of the situations, the pandemic. And we are glad that during these entire changes, we able to graduate to the every next step with the new challenges. So where on one hand, we started with the 3A model, which I have mentioned. At the other hand, when this pandemic came over, we graduated to the next level where the idea was a bit different. One, to address the immediate health needs of the community. And second, very importantly, how to involve with the government, to support the government to help this pandemic to tackle. So with these two things in mind, along with the primary healthcare units, which Mr. Ray, Mrs. Nagpal already mentioned, we came up with two new ideas, that is the telemedicine and the COVID-19 MMU. Now, why we have, along with mobile medical unit, introduced these two concepts also? One, very clearly that when the entire globe, the entire world is suffering with this pandemic, how as a civil society organization and how as a corporate can contribute towards the initiatives of the government. And this is a very beautiful model came up, three stakeholders, government, Ericsson, and a civil society organization, Smile Foundation, came on the same platform, joined hands with government of Tamil Nadu and government of Maharashtra to enhance the COVID testing facilities in the community. And it becomes more important because for a privileged community, it is easy to go back to any lab, easy to go back to any private hospital and get tested. But what about the communities who are absolutely at the bottom of the pyramid? For them, it's a challenge. And that's where actually we have to hit. So this particular van, COVID-19 MMU, which we are running in Tamil Nadu and Maharashtra, helped us to do the active testing and in the margin for the marginalized sections of the society. Also, we are glad to share that along with the marginalized sections of the society, the government has given us this responsibility to do the testings for the government infrastructure, also for the government human resource also. Maybe that is in the form of the testings which we have done in the Rajnivas, the governor's house in Tamil Nadu, maybe for the PSUs, for Indian Railways, and also for the various universities in these two states where we are working upon. Coming to telemedicine part, now when we talking about telemedicine, it is not just about the disbursement of medicines or the health facilities at the doorstep, but it becomes very important that how a doctor sitting at the remote can be taken to the location where the inaccessibility is a challenge. So keeping that concept in mind, we introduced this telemedicine part in the whole process and the intervention, and it worked really well. And I'm glad to share over here that where a corporate came up with the help of finances, a civil society organization came up with the experience, government came up with permissions. I like to mention that community here came up with their own ways where they have given us a free of cost space to run these mobile medical units, which is in a way I can say is a community contribution, and also the kind of acknowledgement from the community, the need that we are meeting over there. Mobile medical units, they are going to the primary healthcare. And I like to mention and quote what Mrs. Nagpal said, that along with the curative part, it is very important how we address the preventive and promotive part. So this is a very holistic approach which we have taken, where on one hand we are addressing the immediate health needs of the community, addressing the disease burden of the community. At the other hand, from the sustainability point of view, we are also working on enhancing the health seeking behavior of the communities through various preventive and promotive initiatives, awareness activities on the ground. Having said that, I like to take all of you through a photo journey in the form of a AV, which will give you a glimpses of the activities which are being done on the ground. Can we have the AV, please?
Thank you, Satnam. Now, I would like to invite Bipasha Patnaik, who leads the skill development vertical SMILE, to give an insight of the program.
Thanks, Vatan. Good morning, everyone. SMILE Foundation's Livelihood Program has a strong alignment with the Skill India mission, an initiative of Government of India for economic upliftment of underserved youth. Ericsson partnered with SMILE Foundation way back in 2015, and with the support of Ericsson, the program has been able to immensely contribute in changing the lives of more than 21,000 youth across 45 centers pan-India. In March 20, while the entire world was fighting COVID, India was no better. Due to lockdown, many businesses in the country were affected, which resulted in loss of employment for many youth in sectors like retail, hospitality, and other service sectors. With the onset of pandemic, there is a need for a lot of healthcare providers. Hence, we align our program to provide skilling in healthcare sector. The same has been echoed in the current budget with thrust on primary healthcare. We are thankful to Ericsson for continued support. Now, I would like to take you through the video for better understanding of the program.
Well, so these were some of the glimpses of our groundwork in the healthcare space. With this, ladies and gentlemen, we have reached to the last segment and very important segment of this event. We are extremely grateful that our chief guest, Dr. Randeep Guleria, agreed to be a part of this event. Thank you, Dr. Guleria. Before I request him to share his views on primary health care, I would like to mention that Dr. Guleria is an Indian pulmonologist and the current director of All India Institute of Medical Sciences, credited with the establishment of India's first center for pulmonary medicines and sleep disorders at AIIMS. He was honored by the Government of India in 2015 with Padma Shri, the fourth highest Indian civilian award. Further, he is also part of and led India's COVID-19 response effort. Apart from this, Dr. Guleria is also co-author of the book Till We Win, India's Fight Against the COVID-19 Pandemic. So, ladies and gentlemen, without further delays, may I invite Dr. Randeep Guleria.
Thank you very much. This is Durga Shakti Nagpal, Deputy Secretary, Ministry of Commerce. Shri Amitabh Ray, MD, Ericsson Global. Shri Shantanu Mishra, Founder and Trustee, Smile Foundation. Other senior members of Smile Foundation, ladies and gentlemen. First of all, really let me congratulate the Smile Foundation and Ericsson for the excellent work that they're doing. And it was really heartwarming to see the type of commitment that they have as far as patient care and reaching out to those who are marginalized in our country is concerned. The COVID pandemic, which started, we had the first case on the 30th of January last year, has really been a huge challenge for us, and it's affected everyone in the country. I think no one has been spared as far as the pandemic is concerned. It's affected livelihood of individuals. It's created a huge strain as far as the public health system or the healthcare is concerned. It's challenged the governance model, and it's created issues between how the governance model should be in various areas, especially when we're looking at the center versus the state. It's also created a huge challenge as far as social and humanitarian needs are concerned, and this was also touched upon, especially migrant population and individuals who were marginalized or who lost their livelihood. And of course, it's led to a huge issue as far as the economic loss is concerned. But if you look at it from the point of view of health, it really put a challenge as far as the public health system was concerned. The public health system actually was the one which came forward and had to really bear the brunt as far as this pandemic was concerned. And I think what we learned was early in the pandemic was that this pandemic is going to be not one which has to be fought in tertiary care hospitals, but at a community based center. If you are going to decrease our number of cases, if you're going to be able to really get a hold of the pandemic, it's not going to be treating patients in the ICU. It's going to be able to prevent patients from reaching the ICU. And that was the biggest challenge. And I think that is why the primary healthcare became one of the major pillars, an important one, as far as this pandemic was concerned. And we realized that this is something which has to be strengthened. And this was one of the, I think, key learnings that we had from the pandemic, because there was a need to create awareness in the community. If we had to have COVID appropriate behavior, if we had to have good testing, and with testing, treating, and tracking, that could only be done with community participation, and that needed primary healthcare involvement. And I'm aware of thousands of ASHA workers and others in the primary health center who really risked their lives and went from house to house, really trying to do a lot of tracking and tracing. So that's where India's basic strength lay. It was also based on a lot of us trying to understand how things were evolving. And as was mentioned by Mrs. Durga Shakti Nagpal, one of the things that we realized very early in one of the meetings that I remember we had with the cabinet secretary was that our focus should be on oxygen. Once a patient lands up on a ventilator, the mortality is very high. If we want to decrease our death rate, we must be able to have oxygen available across the country, even at a primary health level. And as early as February, March, a lot of work was started by the empowered groups to really work on getting oxygen available. But this led to a lot of benefits subsequently. Although it was initially focused on oxygen cylinders being available in various areas and how they would be transported, but it led to a new technology being adopted, the PSA technology, which is basically a pressure swing absorption, which makes one hospital independent and doesn't have to rely on oxygen cylinders. It really uses a technology where you have a zeolite crystal and it takes oxygen from air and is able to deliver it into hospitals. And this became popular, and therefore even remote or rural areas where sometimes it's a difficulty in delivering oxygen cylinders or liquid oxygen can generate their own oxygen and be self-sufficient rather than having to rely on oxygen. And this is something that has really been one of the benefits in terms of hospital care in remote areas and in other hospitals. And I'm very happy to have observed that from the Prime Minister's fund itself, many hospitals have now been funded as far as oxygen plants are concerned for them. But the challenges that we had were urban slums, and I think that's where a lot of focus was put in by the Smile Foundation, and I think they really did a wonderful job. The migrant laborers, and they went from cities to their own villages, and they needed care. Very often they were kept in isolation. They had to be tested. They had to be put in quarantine. That became a huge challenge. And then, of course, the challenge of the marginalized population. They really get neglected as far as this pandemic is concerned, and the healthcare for them really tends to suffer. But I think what we also learned was that many groups, civil society, others, industries came together and really showed the resilience that our country has. And we were able to really build on that from a time when we were looking, or I would say, staring at shortage of N95, PPEs, ventilators, oxygen, and so many other support things. How will we be able to manage them, whether it be providing food to people who were not having a livelihood during the lockdown? People came together and it showed the resilient India that we have in terms of trying to find solutions for that. And I've often said that if we were able to do this in a non pandemic time, we would become a superpower. We have that much of capacity, and we need to really move out of our silos and work as a team, whether we're in the private sector or in the government sector, and really develop a strategy of seeing how the lessons that we've learned as far as working as a team for our country is concerned is important, and how we can really make a huge difference. I mean, I saw people who had from different walks of life come together and contribute, not only in terms of financial contributions, but in terms of helping. If we needed to, if there was a need to develop a ventilator, people from engineering sector, from industry came together to see how we can develop a ventilator. If there was an issue of PPEs, government industry people came forward and said, okay, we would help in looking at how personal protection equipment can be made. Those were the, I think, lessons that we learned, that we can really overcome challenges if we want to. But we have to have public participation. It has to be done starting at a primary level, and community participation and primary healthcare becomes very important. The other important lesson that we learned was telemedicine. For long, we've not been really giving importance to technology in health, and telemedicine is one thing which was ignored, but it became one of the major ways of really providing healthcare during the lockdown to so many patients. And that really showed that has a potential of being able to really reach out to remote areas, to rural India, and be incorporated in primary healthcare in terms of providing quality care even in the remotest remotest part of our country by using that. Mr. Durga Shakti, you mentioned the Dhanvantri, which is the Gujarat model, which is very popular. But there are other models like Smile Foundation has, or even looking at technology even a step forward. You could use a technology where you could do a lot of investigations and be able to have them read by an individual sitting in a bigger center. We did a project 2 years ago where we made what we called a portable chair, and by just sitting on the chair and having a device in front, you could by incorporating a lot of things, this was done with IIT Kharagpur and other entrepreneurs, you could actually have an individual's blood sugar, blood pressure, lung function, and various other parameters done. And this could be done in a mobile van, and you could really do a health screening in remote parts and pick up hypertension, diabetes before it was becoming a major problem and causing organ damage, by having such mobile screening vans where the sample or the test is done there, but through technology it can be transmitted, and the report can be sent again through an SMS or through the mobile. So I think we need to really look at what we've learned as far as healthcare is concerned during the pandemic, and not lose those lessons, but take it forward as we move ahead, and realize the importance of providing care at a primary level and looking at preventive health more importantly now than ever before, because that is something that will make a huge difference in the burden of disease as we move forward. So these are the few things that I would like to say. Thank you very much for inviting me, and I'd like to again congratulate Smile Foundation and Ericsson, and really thank them for the excellent work that they're doing. Thank you very much.
Thank you, Dr. Guleria. I think you rightly said how communities, things need to happen at a community level. The lesson learned, I think you have enlightened us with many lessons that you have learned, seen, and have discussed in this short day. I think further, I would want to say that acknowledgement and endorsement coming from people like you who are experts for the kind of work Smile is doing with the support of Ericsson and other corporates, of course, is very encouraging. Thank you so much for acknowledging our efforts on the ground. So, can I have Dr. Guleria again on the full screen? And we can have all the panelists. Can we have Amitabh on the screen? Yeah. And can I have Mr. Dham also? Mr. Sanjeev Dham, he is the Chief Operating Officer of Smile Foundation. I would request Mr. Sanjeev Dham to give vote of thanks.
Thank you, Swatantra, and good afternoon to everyone. We have started in the morning. Now we have reached to good afternoon stage. We are exactly 12 o'clock. On behalf of Smile Foundation, I would like to extend our sincere thanks to Dr. Randeep Guleria for being part of this deliberation on the primary healthcare topic. Your contribution in healthcare space has inspired many of us. But I think so very important person today, also with us, Ms. Durga Nagpal, for sharing her perspective from the government side. Your thoughts are valuable, and we strongly echo your ideas on roping the corporate and civil society in strengthening the government efforts, especially on the primary health care. My deep appreciation to Mr. Amitabh for immensely contributing in today's session and enlightening that the compassion is the core of our discussion and our partnership. And we really thanks Ericsson Global team for supporting Smile Foundation for last 6 years, and our leadership. Your leadership is very, very critical and pivot to this whole partnership, and we would like to thanks whole team for that. My appreciation to the visionary leadership of Shantanu Mishra, and kudos to the Smile team, which include Swatantra Gupta, Puneet, Bipasha, Satnam, Akanksha, Shriniparna, Garima, Pooja, an entire ground team without whom we would not have been able to reach so far. And once again, thank you to everyone for today's session. Over to you, Swatantra.
Thank you everyone, all the panelists, distinguished speakers. Thank you for your time. And with this, we come to the end of this event. Thank you so much for your time.